Hello and welcome to CCRN Review Certification Coach. My name is David Woodruff and I'm going to be here with you as we progress through this review for a critical care certification. I began my career as a paramedic and worked out in the field for a number of years before I went to nursing school. This gave me the opportunity to be able to see the healthcare setting from the outside. So I got to see what was actually happening in the hospital, and that's what drove me to wanting to be a nurse, is that I really loved the idea of being able to follow the patient through the whole care process. After nursing school, I worked in a variety of different settings, including coronary care, medical intensive care, surgical intensive care, and a level 1 trauma center. I hope to be able to share some of my experiences with you as we progress through and look at what's necessary for the CCRN certification. I began my career when I was fairly young. You're not buying that, huh? Right. Well, let's talk a little bit about what you're going to need in order to be qualified to sit for the certification. First of all, you need an RN licensure. There are two different options. There's a 2-year option and there's a 5-year option. In the 2-year option, you need 1,750 hours of direct patient care, 875 of those being in the last year. And you need to be taking care of acute and progressive care patients. Okay, that's a pretty wide range of patients that you can be caring for that still fit into the category of being qualified to sit for this exam. For example, you could work in a recovery room, you could work in the emergency department, you could work in an intensive care unit or a progressive care unit and still be qualified to be able to sit for the CCRN. There's also a 5-year option, and in the 5-year option, you have to have worked 2,000 hours in direct patient care, and you have to have 144 of those in the last year. Again, taking care of acute and progressive care patients. Now, the reason why there are these two different options for being qualified to sit for the exam is because people take time off. Sometimes people have to take time off for family things and so on and so forth, and that shouldn't interfere with the ability to be able to become certified. So that's why they have a couple different options here for you. So take a look at these options and think about where you would sit in these two different places. Now keep in mind, when you look at this time, it's at 2,000 hours. Holy cow, that sounds like a lot of time, doesn't it? But a full-time job is 2,080 hours a year. Okay, so if you work 1 year full-time, you'd have the 2,000 hours. Now, in the 5-year option, of course, you have to have been working 5 years. But just to give you an idea of how many hours it's talking about here, it's not talking about something unreasonable. You can have these benefits. Okay, so why would you want to pursue certification? It's interesting that 80% of physicians are certified in their specialty area while only 30% of nurses are. I think it's because most of us don't know the value of nursing certification. You can have these benefits: fewer adverse effects, fewer errors, more confidence, higher job satisfaction, better patient satisfaction ratings, and more effective communication and collaboration. That's a lot to get out of having a few extra initials at the end of your name. So what is it about certification that leads to all of these additional benefits? Well, it's not the letters after your name. It's going to be this process that you're going to be doing here with me. As we study for the CCRN exam, you are going to be going back over things that you have learned previously, or maybe you didn't really learn them, you just kind of got through school and, that was something that you really didn't quite understand fully. You understand it enough to be able to go to work and do your job, but maybe you don't understand it at the level that you really probably should. So we're going to go back over and review some of those. At the same time, we're also going to be probably learning some new things because some of these areas may not be areas of your specialty where you're currently working. So we're going to go back over a lot of different things that hopefully by the time you're done with this certification review, you're going to say, wow, I really learned a lot. And once you become certified, you'll say, geez, This process really helped me to be able to grow and be a better nurse. So what do you need to do in order to be able to get there? Okay, well, some people would just sign up and go out and take the exam. That's possible. That's a possible way to do it. And in some cases, people will be successful. In most cases, people would probably struggle with that plan. I know people who have done that and who have passed and have done well. And I know many people who have done that and failed the exam. Now, the problem with taking that second option is if you go in and you fail the exam, very few people go back again and try it a second time. Most people who fail a certification exam will not try again. And then they'll tell you, well, that test is too hard, that test is ridiculous. They test you on stuff you don't even need to know. Things like that people tell you. Well, that's not necessarily true. And what happens a lot of times is that we focus on the things that we don't know. So when somebody comes back and says, boy, I took a pretest on that and it was all about this. Let's say it was all about cardiac, right? It was because they don't really know cardiac very well. So that was the part that really grabbed them and made them feel uncomfortable. So what you're going to do instead is that you're going to make an action plan. You're going to identify your areas of weakness as we go through and we study these different pieces. Now, I would encourage you, do not just study the stuff you like. So yeah, you could skip the endocrine section, but the endocrine section is going to catch you on the exam. So make sure you're doing every one of the sections, not just the ones you like. The ones you like, you can come back and you can play with those later after you've passed the exam. But right now, we got to focus especially on those areas that you don't like so much because those are probably areas of weakness. Choose your study aids. Well, this is one. Okay, this would be a very important one. Another one that I certainly would recommend is Nursing Made Incredibly Easy. The book, Critical Care Nursing Made Incredibly Easy. Great study guide to use for this exam. Even before I began editing the book was very popular as a study guide for this exam. So please consider that as a possibility. Other study aids that are available, heck, you can go to Amazon.com and do a search for CCRN and find a whole bunch of stuff. There's a whole bunch of good aids that are out there. I would certainly recommend the things that come from AACN. They're writing the test, right? So they kind of know what's on it and what to study. So they would focus on those things in their study aids. Plan your study time. Now, that's not just going to happen. Most people have pretty full lives, and we don't have a lot of extra time. So if you're waiting for extra time to come find you, that's not going to happen. So start thinking now about when you're going to do your studies. Commit to a test date. The best way to get started on this road is to go right now. Well, not right now. Okay, let's wait to the end of this video. But right after this video, and let's go to AACN and let's get the information, fill out the application so you can commit to a test date. And getting started, I guarantee that if you get started on this process now, today, and you go through this program, you will be ready to take that exam at the time when you set up your test date. Study. You knew that was coming, right? You knew somebody was going to say you had to study for this thing. Yes, you do. It is unlikely that you are going to do well on the CCRN exam. In fact, there's about a 56% pass rate for those people who study a little bit or don't study at all. And probably if we really had some way to be able to differentiate it, we'd probably find out that those people who don't study at all, the pass rate is probably more like 30%. Okay, but they don't really have data on that. So you need to study. What do you need to study? What's in this program? This program was designed specifically to prepare you for the CCRN exam. I've got more than 15 years of experience with preparing for the CCRN exam. In fact, I have taken it over and over again so that I know what's on the exam and how they're testing. Not that I'm going to give you the answers, but the idea is that you're going to have a better feel for what kind of questions. Because again, they change the questions all the time. Nobody's going to go there and get you the answers, right? They change the questions all the time, and they have a huge test bank. So you can't possibly memorize all the answers to questions. But what you can do is you can understand the kind of questions they're going to give you and understand the kind of thought process you'll need in order to be able to answer those questions. So what can you expect from the exam? The test format is 125 questions. The test map is included here in your program. So the program itself is the test map, the different sections that we're going to go over here. Test questions are all multiple choice. So there's no fill in the blanks. There's no, A and B, but not C, none of that kind of stuff. All right. It's just simple multiple choice. I say simple, but again, we're finding out more. There's all these organizations out there that are testing different ways of wording questions and putting together questions, etc., so that our questions are really getting at your knowledge. So don't expect questions that are going to be very easy that just say something like, what is a normal blood pressure? Okay, that's not going to be on the exam. They know how to form questions that are really going to get at your deep level of knowledge on these different topics. Certification is for 3 years, and you can recertify by using CERPs. That is the AACN's version of basically like CEUs. So it's not, CEUs count for some of them, but you can also get CERPs by doing other things, professional development kind of activities, being involved in service and things like that. You can get CERPs for those. Or, of course, you could retest. If you are a glutton for punishment, you can go out and retest every 3 years. CCRN, by the way, is a designation of critical care certification. It does not mean critical care registered nurse. And they want people to know that because they're not registering nurses. The exam questions. You're going to find that clinical judgment makes up 80%. This is going to be age appropriate for adults. They have an exam for pediatrics. Okay, so this will be age appropriate for adults. Clinical judgment, 80% of the exam. Now, that doesn't mean all of the questions are going to be based upon care as such. I mean, they might be based on ethical issues and things like that too. Professional caring and ethical practice is 20%. And that's any age across the lifespan. It could be the professional caring and ethical practice. One thing to keep in mind about this second piece, the professional caring and ethical practice, that's a big part of the exam. 1/5 of the exam is on this piece. That's good news if you understand their perspective on what professional caring and ethical practice means. So we're going to talk about that so that you can understand their perspective and understand how to answer those questions so that you're getting all of those right. That would be nice to get that whole 20%. The first place you need to go is you need to go to the AACN. Now, you don't need to be able to have this whole website address here. You can just simply go to AACN. You'll notice at the top of the page there's a little icon there, a little thing that says certification. You can click on that, and then you can walk on through the different process of getting to this page. CCRN Adult, you see a little button there. It says Apply. So that's what you're going to do. You're going to click on the little button that says Apply. You're going to apply for the CCRN Adult exam. There are other CCRN exams. There is a CCRN-K Adult. Okay, so that's the knowledge base of CCRN. So it means you're not actually working at the bedside anymore, but you have the knowledge of a certified critical care nurse. There's also the CCRN for those people who work in a environment where you work in those electronic ICUs where you're able to monitor patients indirectly from afar. So that's another abbreviation or another type. The other piece that you have to know or that you need to get in touch with is GoAMP, and this is the Applied Measurement Professionals. And the Applied Measurement Professionals is going to be the organization that is actually giving the exam. So we go to goamp.com, and here you'll find the information about the actual exam. Keep in mind now you can't do this until you get a card from AACN saying, hey, it's okay for you to take the exam. Here is your number. So you need a number that you get from AACN, American Association of Critical Care Nurses. You need that first before you can go here and actually register for the exam. But if you want to, you can come here and you can find out some information about the exam, about where the exam testing sites are, and those kind of things that you might want to know ahead of time. So this is goamp.com. That's the other place that you would want to visit so that you can get started on this journey. But again, you can't register yet until you get the card. Now, they also send it by email, but you get a card in the mail, actual physical card, that shows the number that you're going to use to register here at GoAmp. Then you'll be registered for the exam. Then all it is a matter of that day when you're going to take the exam, you drive to that testing site and you go in and you take the exam. Okay, sounds simple, doesn't it? They'll take some information from you, like your driver's license and so on, and they're going to give you information ahead of time about what you can bring into the testing center. You can't just bring in a bunch of notes and stuff like that. They're going to tell you stuff you can bring in and what you can't bring in and what you can and can't do during the exam. So you go on and you take your exam and you get done, and as soon as you're done, they will tell you whether or not you passed. They give you a little printout and tell you whether or not you passed. So that's kind of nice so that you know walking out, you don't have to sit there and wait for a week or a month or whatever to find out whether or not you're going to pass the exam. Some test taking tips. As we go through this program, you're going to see these little boxes like this one here that says test taking tips. Look here. So as we go throughout the program, there's going to be little test-taking tips as we go along. They may be study skills. They may be exam strategies. These are going to help you to confidently pass the exam. Okay, so look for those boxes as we go along, because those are going to help you to be able to really be focused on this exam. That's the end of this section. Let's move on to the next.